Why does implicit bias lead to misdiagnosis in African American elders? Imagine walking into a doctor's office and feeling like your concerns aren't fully heard or understood. Now, picture that happening repeatedly because of unconscious assumptions made by healthcare providers. That's what can happen with implicit bias. It's like invisible glasses that color how doctors see and treat patients without them realizing it. When it comes to African American elders, these hidden biases can cause serious mistakes in diagnosis. Many healthcare providers might unconsciously associate African American patients with negative stereotypes. They might think these patients exaggerate symptoms or are less likely to follow treatment plans. These false beliefs can lead doctors to dismiss or downplay symptoms like pain or fatigue. For example, African American patients often report pain, but studies show their pain is frequently underestimated. This results in less pain medication being given, even when it's needed. The belief that Black patients have higher pain tolerance or are more likely to misuse medications feeds into this problem. Implicit bias also impacts how doctors communicate and build trust with African American elders. When patients feel ignored or dismissed, they may not share all their symptoms or follow medical advice. This makes it harder to get an accurate picture of their health. Poor communication can lead to misdiagnoses or incorrect ones. It also makes patients less satisfied with care, which can cause them to avoid seeking help in the future. In mental health, the effects of implicit bias are even more noticeable. Diagnoses often depend on how a provider interprets symptoms. African American elders might be wrongly diagnosed with conditions like schizophrenia when their symptoms are actually related to mood disorders or trauma. This misdiagnosis can lead to treatments that don't help or even harm the patient. Addressing implicit bias is key to giving fair, respectful care. Culturally competent care means understanding and respecting the life experiences of African American elders. It involves recognizing one's own unconscious biases and working to reduce their influence. Training healthcare workers to spot and manage implicit bias can make a big difference. Using patient-centered communication and thorough assessments helps ensure everyone gets the right diagnosis. Creating protocols that focus on fairness and equality in evaluating symptoms can also help. When healthcare providers actively work to see each patient as an individual, they can prevent misdiagnosis and improve health outcomes. For African American elders, this means better care, more trust, and healthier lives.